wow.
Welcome, welcome.
I feel bad with my boots on in here.
This photo behind me is a photo that my grandma painted. She looked at a little tiny picture in a magazine or something. It was like itty bitty. And she painted it when my mom was pregnant with me. So I have seen it all my life, and it really represents the care that horses receive. It's a Arabian mare with her baby in a Arabian tent from a long time ago, and horses were quite spoiled back then. So, and the other painting over there, my other grandma painted, so had to have them in here. And then just other things that I've gotten over the years, adding to this. But it's something else to have such a nice office.
Yeah.
I got this at Oktoberfest. It was like $20. And
it suits the office.
Yeah.
Well, what I'm up to is I just called a guy and he wanted to see pictures, get this concreted. And once it's concreted, we get the roof on and get the gates up, and we can start doing quarantine intake buyouts here. Ooh, wow. And so basically a trailer can back right down. We'll have gates on every post, and we'll be able to run the horses into the new quarantine barn that we're building for them, and be able to do all the intake there. So it's very, very exciting. I'm just wondering if we should be moving our squeeze chute before we get fresh concrete out here, because it's very heavy and I'd hate to crack the concrete. So we'll have to figure that out, but it's coming along.
Is that, oh look, Haley's got
cookies. Oh my goodness, we got cookies.
I'm taking some to the vet crew.
They're good vegan cookies. I tried one. They're so good.
They're vegan cookies.
Vegan
Thank
cookies.
you so much, whoever donated these. I'm gonna look at the package. Oh, what does it say? Cheryl's
Cindy,
cookies.
Miss Cindy.
Oh, Miss Cindy.
Miss Cindy sent it to us.
Thank you, Miss Cindy. Oh, we love snacks, guys.
We do.
Thank you.
And our vegan people really appreciate the vegan snacks because they don't eat dairy. Basically anything with the face or a mama, they'll say. So
now Haley's going to take these out to the vets. And we're going to give some to Dr. Gina, Emily, and Caitlin. Dr. Lydia's out today. So anybody want a cookie? Jordan, you want a cookie? I got a frosted one.
what are these?
They're really, really good vegan cookies.
I think they're vegan, yeah.
Do you want this one or do you want?
That one is really good.
Dr. Gina getting one.
Ooh, how nice. Oh, there's so many choices.
Yes.
Oh, yeah. I'm always a chocolate chip person.
Yes.
I'm going to see if we're able to walk Xander across to see if everyone else will follow. If not, then we'll probably use Xander just to kind of run him through instead of using the side-by-sides.
Gotcha. So she's walked him over there, and I think it's a passageway to that next pasture, but I don't think anyone's buying him yet. We got one horse. Okay, everybody else follow. He's like, come on, guys. Join me over here. If I had to guess, that'd be Chance. Here she comes. Are you good, Haley?
We had an exciting announcement during staff meeting. First, I want to say that Chandra is out in California. She's working on getting a really significant donation to help our medical team, and of items. Chandra's amazing at getting items donated or majorly discounted for our organization. She's really excelling. We have all talked as far as management goes, and we're all in support of this. So don't want anyone jumping to conclusions that, oh no. But Miss Lynn is going to be doing a 30-day trial and training of shelter manager. And so everyone was so happy this morning, and yay. And I feel like she's got a lot of productivity that she wants done. So we'll see how it is. So you're going to be stepping into potentially a new role. Lynn started as the volunteer coordinator. Mm-hmm. And has worked her way up through her amazing skills that she has, and I think she's going to do great at this. So
Okay, we've got our high force transfer here, and we've got Milo. Tasha's got Biscuit,
her name's like a road. Her name's Milo.
and now it's Ernie's turn.
Oh, I know. Come here, baby. You've been all over the place. I know. You're a good boy.
Gonna get a good home.
Why is your tongue sticking out?
Okay, well, while we're waiting for another crate, Ernie's just gonna hang out here.
So Ernie is actually yours already.
Yeah, he's already.
He's like, what's going on? Okay, they're off. You'll be okay, Ernie. Alrighty. They're all loaded up. The semi-truck has just arrived. We've got about 30 horses on board, so let's go take a look at them. Hi, little one. I'm gonna get you up soon, okay? Is this a baby? Or is this... Poor baby. Oh. We have a baby.
And he's probably not half the same.
Oh, two.
There's that one, but I don't know if there's anything in it.
Okay, so look how this one's walking. Look how all 4 feet are touching the ground. Not like his hooves, but his ankles.
Okay.
I'm forgetting the technical term for that. But you kind of see what I mean. Yeah, they're no horse's leg should be able to do that. Oh man.
I have this calculus. Nobody wants me counting. You get it wrong. I need to stop walking.
Tawnee built the story up a little bit. I'm not sure how entertaining it really was, although it probably would have been entertaining if you could have watched it. I went to San Diego, flew out Sunday, came home yesterday for a meeting with an incredible organization that's offered to donate some of they're upgrading their entire equine hospital, and so they're donating some of their really nice equine diagnostic and surgical equipment to us, which I'm sure you'll hear about more later. But my flight kept being delayed. So I left here at 3:30 a.m. and then my flight in Nashville was delayed. So I knew I had a really short layover, but I flew through Denver. And as it turns out, I texted my husband a picture of the Denver airport. So my flight landed at like C37, which is like over here. And then my next flight took off at like A16, which is like over here. Denver Airport's a really big airport. And I had like 18 minutes before my next flight was going to take off, but there wasn't another flight from Denver to San Diego that day. So I was like, I gotta make this flight.
Oh no.
And thankfully I just had a little bag. Like I didn't even take a carry-on bag. I just had like a purse basically. So I got off and I also was in the back of the plane. So I was like the last person to get off the plane. And I full on sprinted for 20 minutes from one part of the Denver airport to the other part. I just like full on ran.
Wow.
And I made it. I was the last person on the plane and I was like, basically couldn't breathe. I didn't have a boarding pass because it was supposed to be a longer layover. And I was like, oh, last name is Young. And they were like, just get on the plane. And a bunch of other people on my flight from Nashville to Denver were supposed to catch my connecting flight and none of them made it.
Oh no.
Because I was like a maniac in the airport. But I was like drenched in sweat. I had to take my jacket off. And then the other fun part of the story that's not immediate. And so I had 4 different flights because I had 2 there and 2 back. And on at least 2 of them, we had pretty significant turbulence. So everybody was throwing up. And anyways, it was an arduous journey. But it was pretty funny. One of the flight attendants was like, ma'am, are you okay? And I was like, I know it looks like I'm like in cardiac arrest. I just don't run that often. So anyway, it ended well. I made it to the meeting. We had a very successful trip and got to tour a beautiful hospital, meet a lot of vets who do shelter medicine, and I'm sure you will hear more about them. We're not publicizing who it is quite yet, but it was a great trip. She's got some mammary development.
Yeah,
Are you an older brood mare? I'm gonna touch your mammary gland.
I think she was. But she has a very, very sunken anus.
Yeah, she definitely, look, she's like,
Yeah.
Oh wow.
A lot of these that we got have had mammary development with expressible milk.
yeah. Her radiographs look great in her spine. Look how awesome that looks.
Oh, wow.
Pretty pristine.
A bit of arthritis right there.
Let's do dental reds next, and then let's do this left front.
Left front or left hind?
I think she needs left front and left hind. Did you palpate the left? It looks like a really old bowed tendon. All right, actually, let's do her.
Oh, man.
Let's do her dental reds next. Right? Good girl. A little bit of it.
Very good girl.
She's missing a tooth and she's got a bad hook, but. Good girl. Good girl. That's the mandible. Yeah. I want to put the dental speculum on and look in this mare's mouth to get a better picture of what's going on. And to do that, I rarely do that without sedation. So I'm going to give her just a little bit of a sedate now so that by the time we're done taking the radiographs, she'll be sleepy enough for me to put that speculum on. You're such a good girl.
Okay, they're gonna do dentals on this one, and then they're gonna get started on this other horse over here. So we're gonna do 2 at one time. What a good boy.
Good boy. There you go.
Your poor little forelocks. The burrs. He's got sticky burrs everywhere. On his tail, a few on his legs, and forelocks.
You are 470.
Some on his legs. We gotta get those off.
That lucency change is definitely.
This is him.
Yeah. I think that's very likely what it probably is.
He's actually got some in his ears too. Oh goodness. I did get the ones off his legs. I took those off. I was able to reach them. He was a good boy. So Dr. Gina has found a thyroid mass on him.
This is aluminum, so it looks huge, but it's actually way lighter than.
She's going on the other side to palpate. So what can a thyroid mass ultimately mean?
Neoplasia.
Of herbivores.
I guess it could be a hyperplastic thyroid, but either way, that much of a growth
and then you pass.
would not be really great. We could probably excise it, but then he'd have to be on thyroid meds. But he's also
My mom, who doesn't have any.
an older gentleman.
I'm gonna hold this up for you.
Because usually that hook shows up at 7 or 11.
Really bad hook in the back.
They're not really long in the tooth, so I really don't think they're a good mass.
Okay, so she is missing her third molar on the bottom right, and that was that big hook was that corresponding tooth. I want to take that tooth down just a teeny tiny bit more.
Okay, do I need to grab her tongue again?
Sorry, nope.
Okay.
We're gonna have to be really careful with refeeding this one, but let's go ahead and microchip her and vaccinate her and deworm her. And she can go out in the 10 acre. She's got rain rat pretty severely.
I was just saying she's got a lot of muscle wasting and she's so skinny that you can see her individual cervical vertebra.
Oh, geez.
That's how skinny she is.
So now Dr. Jean's
I'm
gonna
gonna
palpate
sedate
her
her a little
back.
bit.
Oh, goodness. Look
Ew.
how skinny she is.
Probably want with her rads.
Look at Walter. With her rats?
Yeah.
You got it.
And probably hops too.
Rinse. Big rinse.
Yikes.
Yeah, that's not good.
Yeah, her spine looks terrible.
Do you want feet?
All soft tissue. Let's go ahead. Yeah. Okay. Let's do hocks next. I sedated her and put the dental speculum on, and she had very, very bad teeth, very severe hook and wave mouths. I'm impatient and not good at waiting, so I went ahead and fixed a lot of those things, but wasn't able to fully fix her teeth. Dr. Gina palpated her, and she had really severe pain on palpation of her back, and when we took radiographs, we found severe osteoarthritis affecting, I would say, like 80% of the vertebrae through here that look soft tissue. So chronic inflammation and trauma of soft tissue structures and where they attach to bones can result in such significant inflammation that you get basically bone spurs, and she basically has bone spurs. She also has very painful hocks, which is funny because her hock radiographs are not that severe. We really want to give this mare a chance, but with this level of back pain, she's not going to be comfortable even just standing and walking around, and she certainly couldn't comfortably lie down, roll, but she's also at high risk of refeeding syndrome because she's only a body condition score of 1, and she has very significant teeth abnormalities, so she would need a lot of intensive care and would likely continue to be painful. So it's really heartbreaking. She is super duper sweet, but I'm recommending the Laxac and Kindness. She's been painful in this back for a really long time, and we don't want her to suffer any longer. Unfortunately, Keith came and told us that one of the horses from the group that came from the reservation separately lost a foal, and it looks like a probably third trimester fetus, but no viability. It's not surprising. That group of horses is very, very sick. We weren't able to pregnancy check them because they are extremely wild, have never been touched, and they've been really sick. That group of horses had the diphtheria case, which is an infectious risk to humans. So we've been keeping an eye on them from afar. So we are gonna go do a necropsy on that little baby and see if we can find out any obvious causes for that pregnancy loss, and also collect some tissue samples to send to our state diagnostic lab. Because it's an infectious risk to humans, the diphtheria case, the state public health department is involved, the state vet has been notified, and also CDC is working on that sample. So we're gonna go take a look at that baby, and then we're wearing a lot of intense PPE because we don't want to be infectious risk, but then we're going back up to quarantine to look at some more horses there. We will not be dealing with any general population horses the rest of today.
Please don't step on the baby.
Yeah, that's small, actually. That might be small enough to send the whole thing.
I saw it in relation to his foot, and I was like, oh, that's kind of tiny.
Dr. Lydia's gonna go take a look at it real quick.
7 of these are mares.
I think we should send this whole thing. Dr. Gina and I consulted, and we think the fetus is small enough to send the whole thing to the lab, which will give us a more complete set of answers. So we're gonna very carefully handle this little fetus and get it cleaned off enough that we can package it up and send it, and hopefully we'll get some answers. Just based on a real quick glance, I think the dam is probably the larger bay mare, kind of in the center of the group, but these horses are extremely feral, so I can't get a super up close look, but we'll try to determine who lost that baby and make sure that whoever she is, she's doing okay too. I think we should send the placenta. We almost could put the placenta in a separate bag.
I think this one is the mama. The one with the moon-shaped crest blaze thing. It's okay.
You want to close the gate?
Easy.
I feel like
Oh,
all
goodness.
of the vertebrae in her neck.
I'm sorry, but that's got to come out.
Okay, Emily's gonna take out
That can't feel good.
all of that.
Real pokey.
They're everywhere, baby. I'm sorry.
Solid.
Ew.
Ow.
Oh goodness.
Gross. I'm sorry, baby.
Look at the condition. Oh my goodness. Poor thing. Emily's getting more of the locks out
I'm so sorry.
with all the burrs.
She has increased respiratory noises and a tick.
You tick.
I got it. Well, it fell, but
Heart rate's nice and low. That's good for pain assessment. You got some scarred withers. Oh, we got some back pain. You take some wither rods too. See that reactivity right there.
Yeah, I picked the two that.
You've got such beautiful eyes. Look at that gunkety gunky nose. All right.
I had them.
And like the right eye.
They're there. Yeah, the right eye.
I accidentally made her bleed.
Well, I mean, like, she's got like a third eyelid mass and stuff, so most of the time in a pink skinned,
Okay,
blue-eyed
ready?
horse that's squamous cell or something else.
Okay. I know, that was very rude of me. Oh, that is a mass.
Yeah, that's why I was like, that looks like cancer.
Yeah.
And then, like,
Look at her back in.
You know what? It also almost looks like somebody's already operated on this side. Look at that lower lid. It looks
yeah,
like
it's
somebody's tried to
restricted a little
remove-
bit. Is there masses back there too?
She's had a Catholics.
What's that? Is that what that is?
She's been
Here, let me
bred and
hand this
sewn
to you.
up.
Yeah, when they don't want mares to go prematurely into labor, they suture the vulva right here. She's just got scarring from a Catholics.
Her hawk also looks a little bit, or fetlock looks kind of big back there.
She's got a lot of irritation around here. She's got kind of oozing. But see this mass right here? This kind of angry pigmented area right there. And then you can see all these scars on her lower lid. To me, this looks like she's already had a mass removed right here. Like somebody else probably already found a mass and tried to remove it. This looks like an abscess. This is kind of ruptured out here. I know, you're such a sweet girl. Unfortunately, these blue eyes with a lack of pigment, it's almost always squamous cell carcinoma when you have a kind of an angry looking mass affiliated with a depigmented eye. We could confirm that with a biopsy. The hard part is that biopsy is going to be painful for her. So she's also got really severe, I haven't listened to her lungs, but this to me looks like a pneumonia. And you can see
She's got
the way
bad
she's
sounds.
breathing at rest. She's breathing with increased effort and with abdominal effort. So she's got multiple things going on. And she's also, I would BCS her maybe at a 2.
Poor ma'am. You're very cute.
You are a very sweet girl.
gave
That eye
somebody a
has to
lot.
be really irritating.
Yeah.
She's about 19 yesterday. They quickly looked at her teeth and they aged her at about 15, something like that. But I looked more closely at her teeth. I think she's a little bit older than that. And unfortunately, she's got masses on both eyes that are most consistent with squamous cell carcinoma. On the right eye, she's either had a traumatic injury or a surgical resection of her lid. So if you look when she's blinking, she's not able to close that eye all the way. And you can see all of the weepy ooziness around both of those eyes. So she's experiencing discomfort from both of those eyes, even without confirming with a biopsy. it is most likely cancer. If you ask any veterinarian, hey, I have a horse with no pigment around its eye in their teens with a mass, it's cancer until proven otherwise. But this poor little mare also has some really significant puncture wounds on both of her hind legs, and she's got a very low body condition score. She's dropping some feed and showing some evidence of dental pathology. And she also has some abnormalities around her tail head. So this is a tough one for me. 19 is not that old, but if we strongly believe we have multiple cancerous tumors, the likelihood that that cancer has spread elsewhere is also there. And it's always heartbreaking for us because we want everything to go into an adoptive home, but it's also not fair for us to take a horse that likely is going to continue to get sick. We know that cancer makes you feel really terrible, even if we had a year or two of good time. It's hard to ask, and it's a big risk because she might be comfortable, but she might not be comfortable. And she likely would need both of those eyes enucleated for just a little bit more time. It's a pretty big, pretty painful surgery. So this was a hard one. Dr. Gina and I discussed at length, and we both agreed that the last act of kindness is the kindest thing for this mare. So she's getting some good grainies, and then we're going to let her go.
That is so amazing. Mr. Ryan is riding him up and down the alleyway. Oh my gosh, this is so amazing. He's nervous, which is understandable, but oh my gosh, look at him go. Wow. What a good boy. What a good boy. Oh, what a good boy. So Keith, he is going to be taking Justin's place for next week because Tawnee, Jason, and Justin will be gone. So he's trying out filming. So literally Keith
cutting
can
everybody's
do
head off.
well, Keith can do anything, and so he's trying it out. And I'm sorry about the wailing dog in the background.
Yeah, that's a nice sounding doggy back there. If anyone wants a screaming, crying doggy, we got one for you.
It's a very sweet dog.
It is.
They just are very, very loud. But he's trying this out, and he's about to go feed, so he's gonna try film too. But
I'm going to try and do all one-handedly here, so we'll see how it goes.
Look at Keith go.
His teeth look really great, actually. So why do you look terrible, and why are you here? All right, I do need to do a little bit of work. I do think I can use the stand, and you want me to grab it or hold him? His cheek is so strong. All right, gotta get those lowers, buddy. Are you not asleep at all? I like to ask you to do more, but if we could pull the tongue out, he really just has a tiny, tiny bit that needs to be done right here. Okay, let me feel. Okay, can I have the tongue out? Yep. Good boy. All right, let me just palpate and make sure I didn't miss. Oh, I missed one really big one in the back. Okay, sorry team.
You're good.
That's why you feel. This is maybe our whole problem right here. Got it. Oh, beautiful. Okay. I do want to recheck his calcium, like if his calcium is creeping up, but I vote we vaccinate him, kick him out, and see if he gains weight.
Sounds like a good idea.
Okay.
He needs a lot of groceries. But at least he's somewhere a nice space where he can roll and do what he wants to do. There she is. Are you gonna do something today?
Am I? Maybe.
Possibly.
Maybe. Yes. So I am adopting Cherokee today. And then a really wonderful friend of mine is going to be here Sunday, and he's going to haul him home for me.
Yay!
Finally getting my horse!
Oh my gosh, yes. Emily, she fell in love with Cherokee and she really wanted to take him home, and I think things worked out. So.
Oh, yeah.
Okay, I'm going to fill out the paperwork right now. Her and Haley. Okay, she's grabbing his card, gonna put it on the found love wall.
Oh,
And
there he is!
he has his forever home now. Cherokee has his home. That's so loud.
That is loud.